I worked as on the clinical side as an assistant for 21 years. And then I had an opportunity to teach and the timing was right. So I took that opportunity and I taught for, 7 7 years and I loved it. I love teaching. I So that was something I always wanted to do. It was a great experience. And then another opportunity came up and which led me to what I'm doing currently, which is creating this dental assisting collective and just spreading the word about the value and the importance of dental assistants in your practices. So that's,
Absolutely.
yeah, thank you.
I love it. Man, you've been in dentistry for a long time and you look good, Miss Joanne. You look real good. I was
Well,
gonna
thank
be
you.
like, what?
Yeah, yeah. It's been a long time.
Hey, whatever you're doing, please let us know. Maybe we can do the same. I'm falling apart.
Staying
Do you want
active.
to take
That's
your
what you got
cap
to
off,
do.
dog?
I know, no. The cap is the only thing that keeps me safe. That's my savior right here. Master just keep throwing shade at me because I have no hair and he has hair, so he's keep throwing shade at me. But I'm like, that's okay.
Just a little bit.
Just a little.
Funny.
Well, the topic that you mentioned, I mean, the teaching part of that you're teaching kind of the dental assistant, the dentistry part of it, all of that. The one thing that I want to know, because that topic has come up, and I'm sure you probably know about this too, and we have asked this question before, but I believe post COVID, the field of dentistry has changed significantly when it comes to dental assistant and the relationship they have with the doctor, and then the staff shortage. Why do you think that is the case, especially post COVID? Like, what are you seeing has changed that kind of push us to in that direction?
Yeah, I taught through COVID actually, which was very challenging and interesting at the same time. What I found was there was a real mindset shift around the field. And I think, we know what happened during COVID with our profession. There were so many changes. People were starting to retire early. They didn't want to have to deal with, you know,
Hello, everyone. Welcome back to another episode of me, Dr. Milad, and we got the one and only Joanne here
Mm.
today.
Okay, Master, it seems like you're cutting out.
yeah, something's happening here.
I know something is happening. All right, everyone. Well, I guess I'll do the opening. Masood is having some problems here. Well, everyone, welcome back. We are on episode, I don't know, probably 75, 76. I don't know, lost count, but we're there. Today, I don't know, man. Today I'm stuck between two Canadians. So everybody wish me luck. Miss Joanne, thank you so much. I really appreciate you joining us today. I appreciate you doing the course section with Masood. I appreciate all your content that you post on LinkedIn. I think you're at the center of a very important topic in dentistry, and that's dental assisting and how we can retain our assistants and what we can do to be better as doctors. So I really truly appreciate your time. I'm gonna let you introduce yourself, and then we'll kind of get the ball rolling.
Thank you. I'm so happy to be here. Thanks for having me. I think it's great that you're doing what you're doing and, spreading the word about what everybody does and everybody sharing their information. So, I have been in the dental field for close to 30 years. I worked as on the clinical side as an assistant for 21 years. And then I had an opportunity to teach and the timing was right. So I took that opportunity and I taught for, 7 7 years and I loved it. I love teaching. I So that was something I always wanted to do. It was a great experience. And then another opportunity came up and which led me to what I'm doing currently, which is creating this dental assisting collective and just spreading the word about the value and the importance of dental assistants in your practices. So that's,
Absolutely.
yeah, thank you.
I love it. Man, You've been in dentistry for a long time and you look good, Miss Joanne. You look real good. I was
Well,
gonna
thank
be
you.
like, what?
Yeah, yeah. It's been a long time.
Hey, whatever you're doing, please let us know. Maybe we can do the same. I'm falling apart.
Staying
Do you
active,
want to take
that's
your
what you gotta
cap off,
do.
Doc?
I know, no. The cap is the only thing that keeps me safe. That's my savior right here. My students keep throwing shade at me because I have no hair and he has hair, so he's keep throwing shade at me. But I'm like, that's okay.
Just a little bit.
Just a little bit.
Funny.
Well, the topic that you mentioned, I mean, the teaching part of that you're teaching kind of the dental assistant, the dentistry part of it, all of that. The one thing that I want to know, because that topic has come up, and I'm sure you probably know about this too, and we have asked this question before, but I believe post COVID, the field of dentistry has changed significantly when it comes to dental assistant and the relationship they have with the doctor, and then the staff shortage. Why do you think that is the case, especially post COVID? Like, what are you seeing has changed that kind of push us in that direction?
Yeah, I taught through COVID actually, which was very challenging and interesting at the same time. What I found was there was a real mindset shift around the field. And I think, we know what happened during COVID with our profession. There were so many changes. People were starting to retire early. They didn't want to have to deal with, all the new rules and regulations going around about what we had to do as healthcare providers, right? So people were just like, I'm done, I'm out. But people that were coming through, what I found was, there were so many things, and I could go in so many directions with this, but I'll say just a few things as far as, I had people that were coming and starting fresh from, they were moving from other countries here, leaving behind what they, you know, really good jobs to come and start fresh here. And those I found most of the time were the people that really did well because they wanted it. They wanted to do something new and start a new life and a career. Then we had people that maybe were graduating fresh out of high school, mindset shift. There's a mentality difference between the age gaps, and that was huge. And then there was just so many things, and that was one of the things that kind of led me into the direction that where I'm at right now, because there was a lot of, like I said, shifts as far as people not taking the profession as seriously as, let's say, my generation did when we first graduated from school. We were making this was our career. This was our career path. It's not just a job where it was like, "You know what? I don't like it here. I'm gonna leave and go find something else. I don't like this practice. I'm not even gonna try because I don't like how you do things, or I don't like." So there was all of that, and I even saw it and kind of felt it in some ways when I was in the classroom with some of the students, and it's not all of them, but there really was a huge gap in that sense, and, it came down to also I had some truly amazing students, and I still keep in touch with a lot of them. But it was just really when the time came for like for them to move on, and I always said, you're flying the nest, like the birds leave the nest, the mother just pushes them out of the nests, right? It was time to be on their own. Were they all actually ready to be out there as well? Not necessarily. So I found there was just a gap. Like mindset was totally different. There's a lot of, the generation that's younger than us now that's out there. I feel that this is horrible to say, maybe it's not the right thing to say, but there's entitlement. You can't say anything to say, no, I need you to do it like this. Then you're, my God, you're getting mad at me for nothing. No, this is a job. This is your career. You need to do things the right way. You have people's health in your hands. Like this is health and safety. This is infection control protocols that you need to go by the book. There's no option. You can't just, cut corners and do things that because you don't want to do it or you think it's too much work because, oh my God, you have to work, right? It's no, there was a lot of that, and I got one of the things too was along those lines, now I have to say, these people are graduating. Whose name is behind that? So, it got to a point where I was just like, just with all of that, I was like, I loved my job. I really did. I thought it was great, but I wanted people that wanted to be in the profession in my class, not people that were just filling seats for the sake of giving me a class to teach. I actually had said one time, let me interview the students before they come into my class because I want to make sure that they're here for the right reasons, not
Yeah,
just filling a seat for the sake
yeah.
of filling a seat. And that was like, they kind of looked at me and I was like, no, I'm totally serious. They thought I was nuts, but I'm like, no, I want people that want to be here. That's what I want. I want people that want to work in this field, that want to go with it and grow with it and not just do it because they don't know what else to do.
No, that's a very amazing way to approach it, because I think a lot of people, I mean, even including dentists, I'm not saying dental assistant, but even some dentists that me and Masood have done a podcast with, I think they get into the profession not knowing a lot of things, and for them to be able to have the resources to really understand what they're getting themselves into, and not just think, "Oh, man, I'm just gonna get into it because it's good or it's easy or whatever that is." It comes with a lot of responsibility, and if you don't know those responsibility, it makes it difficult to do what you need to do and to stay on track. So yeah, I absolutely agree with that approach. I think that's a very good way of doing it, to really see the reason why somebody want to become dental assistant and
And that was
figure
a
themselves
question,
out.
honestly. Yeah, that was that when I first started with the classes, that was something that I always asked. What brought you to
Mm,
this field? Why are you here? You know, and I went through everybody in the classroom and I got a bunch of different answers, but it really helped me figure out who was there really for the right reasons. And I did get answers where it's like, well, I don't know, I didn't know what else to take. I'm just here. I'm like, oh boy,
yeah,
you know?
that's amazing. Hey, Mr.
Right.
Sharp,
Um,
I said before, I said, who's the scholars that you murder?
Do you wanna see him
the
up close? He's
patient,
pretty
I wasn't
I
too kind to her.
Oh man, you gotta feed
cleaned
them
him up.
some.
Yeah, there we go.
That
That was one of my teaching props when I was teaching online.
I said that whenever I see that skull, it took me. I give me a little bit of a PTSD. It took me to my head and neck class when I was in dental school. I was like, oh man,
Anatomy was the hardest one of the hardest subjects to teach besides
yeah.
radiology. Oh my gosh. Yeah.
Oh, that's funny. That's it. That's it. Go right ahead, but
You guys have a lot in common. You guys are vibing a lot. I think you should pay a visit to Milad, Joanne. I think you guys would make a great assistant dentist. Yeah, relationship.
Funny.
I don't know.
So,
We'll see.
Joanne,
Maybe I'll open up.
yeah, actually, Milad's coming to Vancouver. So, if you want, you don't have to go
Yeah.
all the way to Arizona.
Well, I think the sunshine might be nice in Arizona.
Hey, at least the
Definitely it
sun is the
is.
reason that you can come give us a visit. Yeah, it's the sun is nice.
So, Joanne, the question I was going to ask, you said you asked all of your students about the right reasons. Is there really like a particular kind of right reason? Like, is there one true or wrong answer for why they come to this job? Because anyone could have like different perspectives and anyone could
Yeah.
come to it for different reasons. Someone could have, maybe a friend of theirs was an assistant and, they really got into it. They loved it. Someone else could be, it's something that her mother used to do and now she's doing it. You know
Mhm.
what I mean? So,
I've
there are
had all of
multiple
that,
different
by the
reasons.
way.
There you go. So, what is the like? Is it like a true or false answer? I'm sure it should be a
No, no,
spectrum.
no. No, no, no. It just gave me a better idea of who was in my class and kind of if it was something they might be just testing out to see if they liked it, how could I help them really see the value that they could offer at the end of this program? Like when they get out into a practice, here's what you can do. Like, this is such an important profession, and it's not just, although the program isn't very long, like dental assisting is a 1 year program. In the end, look at all of the responsibilities you have within a practice and just showing there was so many sides to it. So if they were having issues with something, I'm like, you know, think of the reward, like as far as when you see somebody come in and let's say they're nervous, but you helped them get through that procedure and they came out in the end and they were so grateful to you for that. Do you know how nice that feels? Or when you see a full restorative case from start to finish and you see the change in somebody's demeanor and just how they end up walking with confidence when you could see how they would be, a little more reserved before. All of these things, are things that I would share with students because I felt it was just something like important side of dentistry that's not always talked about because the field is challenging at times. Can be very busy and hectic, but there's so much good in it. And that's the side that I'm trying to show them and teach them because, like I said, it really is like, I don't know if you can feel it, but I love this profession. I love what I do. I've been in it for a long time. And like I said, I think just that there's no right or wrong answer. It just gave me a better idea as to how I could help them really find the really good side of dentistry by taking this course and graduating and finding a good job because there are multiple opportunities within this field, and that was the other side of it. And whether they stayed in assisting or if they decided to go on to hygiene, and even later on, if there was something that they're like, well, I don't like sitting chairside, I want to work at the front desk. I want to be a treatment coordinator. I want to go into sales. I want to do XYZ. You know what? There's this much out there for them to choose from. It's not just one lane, it's multiple avenues. So it just gives me a better idea of how I can help them, what their mindset is at the beginning. And hopefully, that was something too that I saw where the change
Mhm.
from where they started off to where they ended up. I'll give you a quick example because one of my first classes that I taught, there was one person who had trauma from her, where she came from in the Middle East. And there was women were not allowed to go to school that was really underground. And she was traumatized and she was not doing very well in the beginning. And I said, listen, I will help you. This is always my goal. I want people to succeed. I want to see them succeed. And especially when I know that they can, I coached her through stuff, helped her get back on track. And, randomly I'll still get a message from her to this day. Thanks, miss. Oh my God, you're the best. And that I need to hear that, but it's nice to hear because she did make it through and she did well. And I know she's working out in the field. I have seen people come through that didn't speak English from the beginning. And come on, tell me how hard it is to learn dental terminology when you can't speak English, number one. And then people were literally going home, translating the textbook into their language, doing the homework and translating it back into English. And you tell me that's not a mindset for success? Like amazing. Like these students, there was 2 of them, were like 90% students in the end. And when people tell me they can't do it, I'm like, "Listen, I've seen people that thought they couldn't do it either, but they put the work in. I can teach you till I'm blue in the face, but you have to do your part on your end." Right? So, there's just so many things. Is there a right or wrong answer back to your question? No, it just gives me a better idea of where somebody's at when they start the program. And
That's
that's the
And
amazing.
same
what?
when you go out into a practice, it's the same idea. Where are you at? What's your mindset right now? How can I help you get through it? How can I help you succeed?
No, I totally agree. And, when you ask those questions, what do you think the right characteristics are there for them not to have but acquire?
What are not the right characteristics?
No, what are the right characteristics?
What
Or
are
what
the
are
right
not the right characteristics? You can go over both routes.
It's just gotta be somebody who's willing to learn, like anybody. You've just gotta have and be teachable and be coachable, just like for anything anybody would ever do. So if you're here, let's say in a program like the one I was teaching, you're putting a lot of money out to pay for it. How about put the effort in to want to succeed and get through? right? So what are the right characteristics? What are the wrong characteristics? I can see from attitudes a lot of, I mean, just like anybody, somebody comes into a practice and they're not pulling their weight. You can see by their attitude. So attitude will show me how they're doing, if they're willing and wanting to put the work in. If they give me a hard time when I'm trying to, give them guidance on something to help them succeed, if I'm getting pushback from that when, and I'll say I didn't get it a lot of the time, but there were people that were definitely challenging, and it had a lot to do with their attitudes of taking direction and basically thinking that they already knew it when they came in. How's that?
That's amazing. The one thing that I have noticed in the industry, and that's from talking to a lot of dentists and having the conversation around the assistants and everything else like that. What I found is sometimes there's a lot of disconnect between the assistant and the doctors based on the comfort level of like where the assistants are at and where the doctor is at. How do you bridge that gap to make that relationship between the assistant and the doctor better so that that communication and the understanding is better?
Well, I think, there's a few things that go along with that. So as far as whoever the assistant is, how long have they been working in the field? Number one, how confident are they with the procedures that are being done? Were they properly onboarded within the practice? Was there proper training given to them? Because I find a lot of the time that can be very overlooked because it's just expected that they should know what to do. So once you kind of fill those gaps, if you give even, we talked about this the other day, these little morning huddles to talk about the patients that you're going to be seeing and giving a little talk after a procedure if something went well, if it didn't go the way you wanted it to, again, telling them, that was a great job or you did a great job. Or next time, how about we do this instead because that didn't work out so well. And I find that once you give constructive feedback in not a tone where you're being aggressive or kind of like yelling or upset with somebody because people usually get defensive when things are said to them that way. But if you talk to them and say, hey, listen, you know what? I really like what you're doing, but how about next time we do it like this? Or next time, don't, you can't, you, we know that you can only, there's certain things you should say when you're working over your patients, right? And then there's certain facial expressions that you should and shouldn't do when you're working over a patient that could potentially make them feel nervous because that's not what you want. So it's just little things like that. And I think that once there's that open communication, the expectations are laid out, you're clear with what you want, and there's open communication where people aren't afraid to speak up and ask questions because people don't like to be made to feel stupid per se, right? So there should be no wrong question for them to ask. Whether it seems like they should know it or not, just be open and talk to them about it. And eventually, that's going to build their confidence to a point where you have this nice, fluid, flowing procedure where things are so great that you guys don't even have to look at each other anymore. It's just whatever's going on. You're passing the instruments, you're mixing materials, you're doing your work on your side. You don't even have to look up because you know you're going to get past the right instrument or material, whatever it is. And that's one thing, that's another thing is that when you know what you're doing to that point, the doctor really shouldn't have to lift their eyes off that small area that you're working in because you don't want to lose the focus and then try and refocus to look back down at this small tooth that you're working on. So there's all of these things. I had a doctor say to me, Joanne, why did you leave me? And we had a good thing going as far as, working together. He didn't have to look up. And I said this the other day was the simple things with watching what your doctor is doing and something so simple as passing an instrument and passing it, not just passing it for the sake of passing it, but look at the direction that the doctor is working on that tooth. Are they working towards the buccal? Are they working towards the lingual? Pass the instrument with the curve of that instrument in the proper direction. Make sure you're passing it if it's in the mandible with the tip facing the mandible if it's an instrument like that, and vice versa to the maxilla. Like those simple things, once you get that down and going, you're good as gold. But it's open communication. It's creating those expectations from the beginning, and just having that clarity set right from the start, because if there's no clarity, there's no confidence, and then the communication breakdown is done.
I love that. I think that's such a important advice from your perspective. What is the because now that we're talking about that, what is the advice that you give the dentist? Because sometimes, even for myself, sometimes I feel like, oh man, maybe I shouldn't say this because it may not come out the right way, or maybe that communication is not going to be as effective the way you want it, or you can't really lay the groundwork for you to have that conversation. What's the advice that you have for the dentist to just kind of like figure out the best way to approach their assistants without it being insulting? Because you touch up on that, and sometimes the assistant may feel like the doctor was being insulting, and even maybe you're frustrated at that moment. But I want to know, like, what is your suggestions when you do want to have that conversation with your assistants without coming across that way? Because sometimes it can be, and I really want to like have that conversation from your point of view as an assistant. If I was your doctor or you were working with a doctor and you wanted them to have that conversation, how would you want them to have that conversation?
So I think it's like anything. In the moment, if you're feeling frustrated from the start, it's probably not the best time to let that out. So it would be, okay, continue with whatever you're doing because that moment has passed. Keep going, and then come back to it after you've had a breather, and then just go up to the assistant after the procedure, because this, I've been in that spot, and when it's come to me and say, "Hey, Joanne, how about, we do it this way next time?" As opposed to, "Well, why didn't you do it like this?" Right? There's 2 ways you can say it. "How about next time we do this?" Or, "How about next time you just pass me this instead of that?" Or whatever the case is that went wrong, instead of going, "Why did you do that? How about, like, why did you made this mistake and da 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 da." Well, of course I'm gonna get upset. Take the breather, come afterwards, after the procedure, maybe when they're doing the next setup or cleanup, and just talk in a calm manner, because I think you'll get the best response when you're not in that moment where you're just like, right? That's what I found, because again, it's somebody who's not, you don't want them, like you said, you don't want them to get their back up. You want it to be a good response, and you want it to come out the right way. So I think, just like anything, if you were mad at somebody for whatever, if you say it in the heat of the moment, it's not going to come out right. But if you walk away and then you come back, it's going to come out better. So that's, I think, a big thing to remember, because again, we all get frustrated and we just want to go blah 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 blah, but it's not the right moment to do it.
Absolutely, man. I think that's such a amazing advice that you just gave, because to be honest with you, sometimes in the moment of frustration, especially like with I'm sure you know, with dentistry, it's just some procedures are just like, man, like, like you're like, I can't get this isolation, I can't do this, and then your assistant does something, and it happens to me as well, where I'm like, in the moment of frustration, you say something, and then a couple of minutes later, you really regret that moment. And you're like, man, I wish I wouldn't have said that. So yeah, I
Hmm.
agree. I think that's such a great advice to kind of be very careful in the moment. Doesn't matter. Like sometimes, stepping out of the operating room, even stepping out of the office and getting the fresh air makes such a huge difference in how your approach is to certain things. So I absolutely agree
Yeah.
with that statement.
Well, and there's always, I know we used to, when I was assisting with this one particular doctor, it would just be if we weren't sure about something, because you don't want your patients to be uncomfortable because of how things came out or how something was said, because then everybody's like, "Oh my God, what is happening up there?" Where we would just do one of these. If, I would just get this. I get the look. And I'm like, "Oh, okay. All right. I know you don't want that, or I know I need to do this, or I know the pay whatever it is, move your section, put it over here instead." I'm like, "Okay." But it would just be a look, like, and it ended up in the end, being funny because I knew exactly. It wasn't even something I took to heart. It was just like, gotcha. Like I got your back, not like, oh, you I got you. I know what you need. So, okay, I hear you or I see you, as opposed to making and saying something that is going to make the patient feel uncomfortable. And then your assistant's going to start to feel nervous and uncomfortable. So it goes every direction, right? So, yeah.
I was telling my assistant today. It's so funny we were talking. I was telling myself, I was like, stop being so sensitive about everything.
Oops.
Oops.
Yeah. Yeah. Yeah.
Yeah, every time she walks up to me, she's like, Doc, I'm like, why every time you walk up to me, you want to talk, you act like you're about to cry? I'm like, stop being so sensitive. Just talk to me.
Aw.
I know, she's
That
funny.
means
She's
she
funny.
cares.
She does. She does. My assistant is amazing. I mean, I love she's very, very like personable. She's very good at what she does. I mean, yeah, but it's for me, even as I graduated dental school a couple of years back, and I have a lot of life experience. But I think dentistry are really adapting to individual and adapting to the environment that you're working at and the pressure that it's on you in that moment. Sometimes it's hard as a dentist to figure out what you're doing in the moment because you're frustrated in your own mind. And sometimes even for the younger doctors, man, and they don't have that mentorship and they don't have things that they can ask questions, it causes a frustration for them. So
Well,
I
and
can kind of
everything's on
understand
your
it.
shoulders. Yeah.
Yes. Yeah. So I
And
think
I
that's
think that's the
that's
other
what it
side of the stress, and that's where it comes from because it's like everybody's looking to you to be the, you know,
yep.
"Here, you gotta do everything right for me and make me feel better and do it now in the chair so that I can walk out of here feeling better than I did when I came in." So, but that's why I say, like, training your assistants and having this proper onboarding for them so that they are trained and it's not just, "Here, I'm gonna throw you to the fire." Because really, that's what happens. These
That's
things
right.
are overlooked, and then that's how people get frustrated, they quit, they leave, or they burn out, whatever it is. So if there's proper support for them within the practice, it's gonna make a huge difference. And I said this the other day too, is you're a team. You have to work together. Everybody has their positions to play, and I relate it to sports. Like, my kids play sports, and you're on a court. If somebody's not playing their position, there's going to be a turnover and people are going to get upset. Same thing in the office. If you're not playing playing your role in the office, somebody's going to get thrown off. Somebody at the front desk is going to get mad because you didn't tell them a code or something wasn't entered or the patient wasn't given proper instructions before they left, whatever the case is. And now it's on the front desk. And now you have to call the assistant to come back because they didn't finish their job properly because they had other patients waiting. Is the schedule overbooked or is it really tightly booked? And there's not enough time for the transition between. How many assistants are you working with in your practice? There's so many factors. So,
Yeah.
right? So
Absolutely.
it's just making sure that the assistants have a lot on their shoulders as well, like managing the turnovers of the chairs, the
Yeah.
patients getting them in, hopefully on time, or as best as on time as we can, managing sterilization, infection control, right?
Absolutely.
Getting all of these things done, managing ordering if they're doing the ordering, because I know
Yeah.
that doesn't happen in every practice, but there's so much. And
Yeah.
it's not just thinking right in this moment, it's thinking one, two steps ahead, right?
Yeah.
So it's
Absolutely.
I say multitasking and being the ultimate multitasker that you can be, and you have to learn that. Some
Yeah.
people don't have that.
Don't have that. I think that's a skill that you gotta have if you're getting into this field because
Yes,
sometimes you
you
have to
have
be
to.
able to do
Yeah,
multiple of things in one time. And
yeah,
I absolutely, and it's so funny. I was watching a video and it was showing like the assistants in the office, they're running around doing all this crazy thing, and the doctor came in for 30 seconds. Now he's back in his office drinking a coffee. I'm like, that's
yeah,
pretty accurate.
yeah. They got to keep going, keep things moving for you, right?
I know. Well, Miss Joanne, I really appreciate this conversation. This was such a, even for me, I learned so much from having this conversation. I truly appreciate the fact that you took the time and you came on. I hope that the cold weather is not too bad for you. I'll enjoy the sun for you. Don't worry.
Yeah, it's okay. Just rub it in there, eh? Yeah.
Ms. Joanne, thank you so much for joining us. I really, truly appreciate it. I can't wait for us to have more of these conversations, for us to collaborate down the road with Dentment. Please, if you ever need anything from me, Masood, anything, we're always here to help. Whatever it is that you need, please always reach out. We are just add us to the list of your friends. I would like to be your friend, so please add us to the list of your friends.
Sounds like a plan. I would love to do another episode.
We will absolutely do. I know we're actually coming out with some new ideas, so we may bring you back for that one. So
Oh, no,
Yeah, that's
you
the part
will.
where
You will.
surprises come in if you want to be a part of it.
that's where the surprises coming in. Masood is coming out with
No.
some surprises. So we'll see what happens. Just be ready. I will reach back out the same as Joanne. That time has come.
All right, I'll be waiting.
Ms. Joanne, thank you so much. I really appreciate it.
Yes, thanks for having me on. It was
For
great. I
sure.
appreciate it.
Thank you,
Absolutely.
Joanne. Thank you. Have a good day.